Occupational therapists, you are starting an exciting journey. This path will teach you how to help people live their lives to the fullest. A very important part of this journey is learning about assessments. Think of an assessment as a special tool. It is like a detective's magnifying glass. It helps you see things more clearly. Occupational therapy assessments are the methods we use to gather important information about our clients. What a person can do, what they have trouble with, what they want to achieve in their daily life. So, what does an assessment really do? It's more than just a test or a quiz. An assessment is a conversation. It can be a structured activity. It can also be a simple observation. We use these methods to learn about a client's strengths and challenges. Watch how a person makes a cup of tea. Assessments are incredibly important for you as a student and for your future clients. For clients, a good assessment is the beginning of hope. It is the moment they realize someone is truly trying to understand their struggles. Think about a person who has had a stroke. They might feel frustrated because they can no longer get dressed on their own. A thorough assessment helps us pinpoint the exact reason why. Is it a problem with balance? Is it weakness in one arm? Is it difficulty remembering the steps? The assessment gives us the answers, which allows us to create a very specific and helpful therapy plan. For you, the occupational therapy student, learning about assessments is like learning the alphabet. You cannot write a story without knowing your letters. Similarly, you cannot be an effective therapist without knowing how to assess. These tools provide the evidence for your clinical decisions. Before we dive deep into a full evaluation, we often start with a screening. A screening is a quick look. It is like peeking through a doorway to see if you need to go into the room. A screening tool helps us decide if a person would benefit from a more comprehensive occupational therapy assessment. It is not meant to diagnose a problem. It simply raises a flag. It tells us, hey, we should look more closely at this person's situation. Screenings are often fast and easy to administer, making them very useful in busy settings like hospitals or schools. Think of a school-based occupational therapist. A teacher might say, I'm worried about Johnny's handwriting. The therapist might not have time to do a full 2-hour assessment for every child. Instead, she could use a quick screening tool. This might involve watching Johnny copy some shapes or write his name. Based on this short observation, the therapist can determine if Johnny's difficulties are significant enough to warrant a full evaluation. The screening helps to efficiently identify the children who need the most help, ensuring that resources are used wisely. Screening tools are designed to be sensitive. This means they are good at catching potential problems. A common example is the Developmental Coordination Disorder Questionnaire, or DCDQ. This is a form that parents or teachers can fill out. Now let's talk about standardized assessments. The word standardized might sound a bit intimidating, but it just means the assessment is done the exact same way every time. It has a strict set of rules. There is a specific script to read. There are precise instructions for scoring. This is very important. Why? Because it makes the assessment fair and reliable. It means if you test a client in California and another therapist tests the same client in New York, you should both get very similar results. These assessments often have norms, scores from a very large group of people. This lets you compare your client's performance to others of the same age or with a similar condition. For example, the Peabody Developmental Motor Scales, PDMS-2, is a standardized test for children. It assesses fine motor skills. It assesses gross motor skills. When you get a score, you can look at a chart and see how that child's performance compares to thousands of other children their age. This helps you understand if a child's development is on track or if there is a delay that needs attention. Using a standardized assessment requires careful practice. You must follow the manual exactly. You cannot change the words you say or the materials you use. Measure precisely. While standardized assessments give us numbers and comparisons, non-standardized assessments tell us a story. These tools are more flexible. They don't have strict rules or rigid scoring. They let you be a detective, use clinical reasoning. The goal is a rich, detailed picture of the client's life in natural context. Understand the person behind the diagnosis. These assessments feel like a conversation or a collaborative activity. The most common type is the interview. Tell me about a typical day for you. What is the hardest part of your morning? You learn what is important to them. You learn their routines. You learn their challenges. Qualitative info is as valuable as quantitative test data. Observation is a key method. It's the heart and soul of OT. Watch the client doing a meaningful activity. Example, a client with a prosthetic arm making a sandwich, not just physical skills. Observe how they set up the task, notice if they get frustrated, see the strategies they use. This gives a holistic view of physical, cognitive, and emotional factors affecting performance. The beauty is flexibility. Adapt to each client's needs and create individualized plans of care. Let's explore some specific types of non-standardized assessments to make them even clearer. One of the most powerful tools is the occupational profile. This is a structured conversation at the very beginning of your relationship with a client. The goal is to understand their occupational history, interests, values, and priorities. What do you want to do? This information is the foundation of a client-centered plan. Checklists and questionnaires are also very useful non-standardized tools. These are not the same as standardized questionnaires with norms, often created by therapists or clinics to gather specific information. For example, a therapist might create a checklist for morning routines. It could list steps like getting dressed, brushing teeth, eating breakfast. The client or caregiver checks which steps are easy and which are difficult. Another valuable method is performance analysis, a structured form of observation. As you watch, identify performance skills that help or hinder. Break a complex activity into parts to pinpoint where intervention is needed most. Finally, don't underestimate asking a client to draw or write. For clients who struggle verbally, drawing a home or listing hobbies gives insight. A home drawing might show stairs as a huge, scary obstacle, important qualitative data. These creative methods help connect deeply and gather rich data not captured by other assessments. Knowing about assessments is one thing, but being able to use them confidently is another. The key is practice. You need to get your hands on these tools and try them out. Start with your classmates. Find a partner and take turns being the therapist and the client. Read the script, handle the materials, go through the scoring process. It will feel awkward at first, but this is a safe way to make mistakes and learn. Next, volunteer for opportunities to practice on real people, on-campus clinics and community outreach. Sign up for everything you can. Your professors and clinical supervisors are there to guide you. They can give you feedback on your technique and help you build confidence. Use that feedback. You can also practice non-standardized assessment skills all the time. Practice active listening with friends and family. Pay attention to nonverbal cues. Ask open-ended questions that encourage sharing. Become an expert on a few key assessments. You do not need to know every tool that exists. Choose ones commonly used in the practice area that interests you. Pediatrics, geriatrics, etc. Watch demo videos, practice scoring sample cases, and get familiar with the manual. After you administer an assessment, do not just look at the score. Think about what it means. Connect observations, interview data, and test results. Write a clear summary report as if for a supervising therapist. As a student, you have many resources available to help you master assessments. Your number one resource is your professors. They are experts. Do not be afraid to ask questions and use office hours. Textbooks and course materials are your next best friend. Manuals for standardized assessments are especially important. Know them well. They are the rulebooks. Read them cover to cover. Many publishers have online resources, training videos, scoring software, and FAQs. Do not forget the power of your peers. Form a study group and practice assessments on one another. Work through case studies together and teach concepts to each other. Teaching solidifies learning. Learn outside the classroom, attend workshops and webinars. Many associations and publishers offer training and CE at student rates. American Occupational Therapy Association and state associations are great resources. Follow OT blogs and social accounts where experienced therapists share case studies and practical tips. Immerse yourself in OT to stay curious and motivated as you build your assessment toolkit. Pool your knowledge and help each other learn. Attend conferences and collect CE that strengthen your assessment skills. Keep learning. Small daily steps compound into expertise. Stay curious and motivated as you build your assessment toolkit. As you move forward in your studies, remember that learning to use assessments is a marathon, not a sprint. No one expects you to be an expert overnight. It is a skill you will develop throughout your career. Be patient with yourself. Every experience, classroom or clinic, is a building block for confidence. Celebrate small victories, like the first time you score a standardized test correctly, or the moment a client shares something important during an interview. Your education does not end when you graduate. It is the beginning of a new phase of learning. Talk to other therapists. Ask questions. Learn about tools they use. When you use an assessment, you are building a relationship. You are communicating that you see and hear your client. You are there to walk alongside them on their journey. This human connection is the magic that makes occupational therapy so rewarding. So, take a deep breath. You have got this. Your journey to becoming a confident assessor starts now, with the next chapter you read or the next practice session you do. Trust the process, trust your professors, and most importantly, trust yourself. You are on the path to making a real difference in people's lives.